Hey, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare professionals and clinicians to offer body composition solutions. I'm so excited to be joined today by Jeannie Boyer. She's a registered dietitian and friend and colleague of mine, and we've worked together in various ways over the years. So I brought her on here to talk to us a little bit about weight management, obesity care, but even more what she's getting into most recently, which is in the wellness retreat kind of aesthetics realm, and I think we're going to have lots to talk about.
Yeah, I'm excited to be here. Thanks for having me.
Yeah, so I know we both lived in Charleston, South Carolina for a while. So I know you're recently moved to North Carolina and in a totally different role. But give me a little bit of a background and kind of your experience in the field as a dietitian, because you've done a lot.
Yeah, I started off in the hospital and very quickly, no, that's not my spot, and got into bariatrics and weight management and just loved it. Just really passionate about that area of study and how much you can see lives changed in bariatric surgery. But with moving to North Carolina, there's not a bariatric center in this tiny town. But there's a beautiful wellness retreat center. And so I got lucky and got a position there. And it's been really cool to kind of be in a different role with different clientele, and see how much change we can make happen in a week or 4 weeks with people.
So they stay there for a couple
Yeah,
weeks, a
so
week minimum.
people will say a week minimum, but the people that are in there for a weight loss journey will stay for a month. Some stay for two. Some people come back.
Okay,
So it's a really cool environment that's comfortable, and not too clinical. So
nice.
it's fun.
Well, I think that's also interesting too, because I know in bariatrics, in my past experience, it's this is your patient for life, right? You know that if you're with that program, you're going to see these patients off and on, for their whole journey, and that kind of hits to the chronic nature of the disease of obesity. So that must be a big change too.
It is. I wake up sometimes and think like, oh, I don't know what happened to so and so, but luckily, like I have their emails and people that I've worked with closely, I can reach out to, and they keep us in the loop of what's going on with them. So it's
I think of a lot of times I think of kind of our role as dietitians in the sort of prevention and then treatment and management and kind of that long term. So it's kind of
Mhm.
you've spent a lot of time in the treatment management realm and now a little bit more on the, I don't
Yeah.
know if it feels prevention or, kind of in that earlier stage where you're probably doing a lot more education
Mhm.
potentially or
Right, totally. It does feel a lot more like in the prevention realm, and in the it's not to use a buzzy word, but it is more holistic. Like
mm,
I don't have to just talk about a diet prescription or a list of vitamins. Like I can kind of expand the
mm.
subject a little more with guests, which is great because I can talk more about how are you feeling, what is your stress level, what, and I have the time to do
Mm.
that for them instead
So
of
how
like,
do you
"Okay, next patient."
yeah, and not based in a clinical setting, how do you see the patients
So they can
or
schedule
clients?
one.
They're not
Yeah,
patients.
no, I have to change my terminology. They're guests.
Yes.
Um, I have to. They can sign up for one-on-ones at any point during their stay. So, and we have an hour or hour and 15 minutes together,
Okay.
and then I can just see them passing in the hall, and they can ask follow-up questions, and we
And
can
you do
go around the hall,
group education.
and then group classes to the entire guests are available. Like whoever's there can come, and then some more specifically just for those that are in the weight loss track.
Okay. I
Mhm.
wonder if it's similar the down here in South Carolina, the Hilton Head Health program. It sounds a little bit
It
like that.
does. I need to look into that one. Yeah,
Yeah. So do they have body composition at the center?
it's great. They have it. Every guest does it first day,
Okay.
first thing in the morning. So they have that data, and then before they leave, so they're able to see what changes they've made, and
Oh
not
wow.
just. I mean, you've talked about this a lot, but it's not just those three digits. Like, okay, 175 pounds, great, um, but they are able to see muscle, water, fat, visceral fat. which is much more motivating
Yeah.
than
Oh,
a long.
how did they respond to it there? In that setting, are they working really hard to change those numbers, or they're just, it sounds also maybe more holistically viewing
Mhm.
this as, biochemical data that's part of an assessment that,
Right.
is malleable or changeable a bit.
Um, we totally focus on the skeletal muscle mass versus fat mass and visceral fat and kind of let
Okay.
all the other numbers go
Okay.
because of what we know about the metabolic activity of the muscle, really. So it's good. It's sometimes limiting because of the short time. It'd be
Right.
great. I would love to know that each person could go home and know where to go to get on a scale every 3 months or something.
Hmm.
Mhm.
I love that. I mean, those are the ones that I focus on too the most. And I do think, as we're hearing more about fat free mass and lean body mass as being numbers that maybe we don't focus on as much because the muscle, especially if we're
Yeah.
talking about, high intensity exercise programs or even some of the new generation weight management medications, that the muscle is really the important
Mhm.
part.
Mhm.
That's cool.
I think
Yeah.
it's sometimes
So,
hard to get people when they see that total weight number go up. It's such a scary thing, and we're so used to being frustrated and mad about that. But we can look under that and say, but you gained 3 pounds of muscle or lost this much fat. So I just love that we have more data to discuss.
yeah. Well, and I'm thinking too, if you're seeing them kind of for a special month or week or so, and they're getting comfortable with the body composition assessments, that sort of sends them off to maybe ask their healthcare providers or look in their community in a
Mhm.
fitness kind of a realm to see where they could find that elsewhere.
Yeah. Yeah. I sat down with a guest the other day and we pulled up the map and I was like, okay, this far out of your town is a scale you can get on. And
Nice.
it's good to know that she has that resource.
So are they in that setting as focused on total weight and BMI as we kind of see healthcare, or is it a little bit less?
It's less. It's great. I haven't talked about BMI in a few months. Um,
Nice.
I just look at these visceral fat, skeletal muscle, and yeah, we don't talk
So they're
about it.
not coming in asking for feedback on that either. Okay.
Mhm.
Cool.
Yeah,
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 that is
it's
nice. That is
yeah.
nice. It's funny too. I think as just thinking about sort of your move and transition to, and mine, in a very clinical setting with a metabolic surgical weight loss program, just how things have changed so much in the past like
Mhm.
3 or 4 years, where it used to be so segmented, right? Like, were you a surgery program? Were you a medical program? Were you lifestyle? It was definitely either or. And now I'm seeing so much more, not just even collaboration for comprehensive care, but just patients kind of going or clients going in and out of the spectrum from healthcare to
Yeah.
wellness to fitness, and
Mhm.
that's kind of nice to sort of see everybody coming together holistically to look at health.
Right. It's great. Like I work closely with a physical trainer now, and in our conversations, it's great to know like, oh, we're on the same page, and he's also looking at composition and not just numbers on the scale, and like considers having enough fuel to do his
Mhm.
workouts. We were even talking the other day about how years ago we would tell somebody, "Oh, you've gained weight. Like you must not be following the meal plan."
Oh my gosh.
Like I've said that like 20 years ago because that's we didn't have body composition. Like we just didn't know all the great things we know now, and now I can kind of look at what's your stress level like, or did you get enough sleep, or maybe that number is muscle. Like we can dig a little further.
That's big.
Yeah.
Yeah. And the language too around that. I've also thought about that, 20 years ago, what I would present on, or what was
Mhm.
what was in my conversations with our patients. And I
Mhm.
do feel like hopefully, we realize that as we learn and grow, we
Yep.
can do better. and
Yes.
and I think that, even like you said about body composition, back when I was in school, we didn't learn too
Yep.
much about all the different methods, and it was, if you were lucky enough to get in a clinic that had it, you just sort of used what they had. So it's been fun for me sort of educating other healthcare providers, or clinicians on hey, you guys, it's different than 20 years ago.
Mhm.
It's not just this all day research method where you've got to do underwater weighing or,
Right.
something like that that's gold standard or, you know, the, the be all end all. It's a lot more like we have some really good tools that you can put in a clinical setting, in a fitness, in a,
Right.
aesthetics, in a wellness kind of a setting that you can get
Mhm.
quick feedback and quick numbers to help supplement the counseling. And I think that's what it's all about.
For sure. Yeah, it used to be like the water displacement gold standard, totally inaccessible. And now we can say, oh, we've got these scales that tell us so much more.
Totally.
Mhm.
and and we do have a lot of people asking about at home scales and what they can do at
Yeah.
home. I know that's a big topic of conversation here. We haven't I have, this is a whole nother topic, but I have a lot of thoughts on should we be doing body composition that frequently at home. And I know you also have a background with a lot of behavioral and
Mhm.
counseling. I have trouble thinking about how much people get obsessed with the weight on the scale when they do at home weighing. And
Mhm.
so if you're giving them that kind of power at home without you or me home with them to sort of, put
Yeah.
it in perspective, remind people that there's
Mhm.
fluctuations, really look at how long does it take to change your actual composition. It's a lot longer than you need at home. And I don't focus on that. I think there's some trend reasons to do some trending at home, and it's not it's not
Yeah,
bad, but I don't necessarily look at all that data as being entirely positive.
I agree. I feel the same way about all the watches, like if we get so obsessed about, oh, I took 903 steps versus 1,005, or slept 8 hours versus 7.5, and then we add this, like, oh, my muscle went down by 0.03% yesterday. I must have not. Yeah, it's crazy making.
Yeah, I always remembered sort of giving that example to our surgical patients of, they would get on the scale in the morning and say, oh, my weight's up. Wait, I had a banana for breakfast. I can never have that banana again because that's
Yeah.
the reason the scale's not matching my efforts.
Mm-hmm.
Um, and it sounds silly when you're saying it out loud like that, but that is, one
That's
of the
right.
thought patterns that people get into.
Or the opposite of whatever, vacation or a party, or
Mm,
I ate like crap yesterday and I got on the scale today and lost a pound. Like,
guess that's okay.
right.
Yeah.
Mhm.
Yeah, we do look for the data to support sometimes what we want it to
Right.
show us.
Or to be like an immediate response.
Hmm.
Like, right. What the scale's not showing yesterday or the last hour.
Yeah. Well, in that regard, then I think you can also use sort of the body comp data to support why it needs to be done longer term and why it really is the long haul.
Yeah.
Especially with, we're talking about maybe different levels of someone's excess adiposity, right? But for someone
Mhm.
who's at the higher levels, who's really trying to bring that down, it's a long-term relationship. It is it's not just come and be, on something for a few weeks to months. It's more like our surgical paradigm where, you're going to be in care probably and hopefully forever so that you have support, maybe like therapy, right?
Yeah.
Sometimes you can do short term. You might need a short term treatment, but for most people who have the chronic disease of obesity, it really is a long term
Right.
relationship.
I totally agree. I often use the example of a car. Like if you have a, I would say a new car, but any car, like there's a maintenance schedule to it. You don't just drive it and you're good to go. Like you've got to change the oil and you've got to rotate the tires and you've got to put gas in it. And it's kind of like the disease of obesity. We can't just say, oh, well, you had surgery, you're good to go. You don't have to think about anything again. Or, you have a new exercise program. It takes like that check in and those little moments of recalibration and
Mm,
kind of looking back.
yeah, that is a good analogy. People do seem to have trouble understanding kind of the interplay nowadays. I'm seeing more with the medications and
Mhm.
nutrition, right? Like again, like all the things that media and people want to put in either or kind of a bucket. It's like, oh, well, now that people are taking medications, they're not going to engage with nutrition because they're losing weight without
Yep.
having to, right?
Right.
and I know that the more forward thinking and, people who historically have done this and, people who understand behavior really understand that it's not distinct separate buckets. It's a,
Mhm.
continuum and it's
Right.
an ebb and flow. Sometimes you'll be, in this realm, you might be doing better. You might need this kind of a help. I really look at it like that.
Right. Yeah. What else is going on in life?
Yeah.
Mhm.
Well, the other thing I wanted to talk to you about, because this was a very recent episode of the White Lotus,
Yeah.
which season 3 is out, and I love that show. So
Yeah.
I was thinking about you in this new role and
I
how
know.
much
It's just,
how
it
much
feels
it's like that. I don't know. North Carolina might be a little bit
fine
different.
as fancy, but yeah.
Maybe season 4 could follow
Right.
you up there. But this recently they had an episode where they had a body composition analyzer in kind of the facility. And so have you seen this episode?
I just watched it last night. Yeah.
Okay. It got me really thinking a lot about, well, they did a few things right. They did a couple of things
Yeah.
kind of strange. But I think some of it gets to the human behavior, right? So
Mhm.
the stuff I really liked that they talked about like personalized healthcare and, or not even healthcare, personalized care and regimens and looking at that individual person's body composition data to create a personal plan, right? I mean,
Mhm.
I feel like that's kind of what I've always done, taking the person for where they're at. Like to me, that
Mhm.
gets to patient-centered care.
Yep.
And
100%.
in your role now, I'm imagining that's really what it's all about, right?
Right. Like I'm there to meet that person where they are. I actually said that in my interview, and the general manager was like, "That's exactly what their like mission is, or something."
Yeah.
Um, but right, like each person has a totally unique background, where they're coming from, goals, body systems, and we've got to speak to that. So it was interesting to watch the episode, and not just in that scene, but a couple times they were like, "Oh, we're gonna meet and work on your plan,
Mm.
and you're gonna do this." Um, so that was good.
Yeah.
But it was interesting to see how in that one, the three friends, like how they discussed their results among each other was a little.
Yeah. So if anybody hasn't seen it, they talk first, I think, about hey, this is, I think they said 25%. I'm assuming they were talking about percent body fat.
Oh yeah, yeah,
And they were using that. I mean, we don't have national cutoffs for actually where someone unilaterally would fall for good or bad, right?
yeah.
We wouldn't phrase it that way anyway.
Mhm.
But yeah, they started kind of comparing, and the one girl who was a celebrity was kind of like offended that her friend,
Got
her
the same
numbers were the
score.
same.
Yeah, yeah.
But people do that, right? I mean, I've seen that a lot at conferences that we go to, where someone gets on
Oh,
the body composition analyzer, and they get their results, and then they're waiting for their friend or their colleague and say like, well, what did you get? And
yeah.
so it's kind of the opposite of the goal of individualized care is that you are your N of one, and we can take your data of starting and work on a plan together and then kind of get you somewhere
Yeah.
towards your goals. That's sort of the opposite.
Oh, yeah.
But
Yeah.
yeah, that, and then the other thing, I think somebody in the episode said like, um, they're giving everybody the same kind of
Oh, right.
advice, right? Like everybody gets that same feedback, and so I
Right.
would say that isn't, a miss. They didn't
Right.
get that right.
Right.
It's important in the folks who I train and educate and how they're talking to their patients or clients, really that they do a good job framing all of this. So it's funny how much language and communication has come back into this role,
Mhm.
um, that I did so much in bariatrics.
Right. I just recorded something for a course with somebody talking about the just non-compliance. I think the title was, oh, I don't remember, supporting failures or something. And I started with the fact, like, I hate that word, non-compliance. Like, it's just what we type in the EMR. It's just like, didn't do it, non-compliant. But when we look back on ourselves, like, I've been non-compliant with every goal I've set. Like, it takes
Yeah.
repetition. Like the first efforts are not going to result in perfection. And there's so many things that come into play that would cause somebody not to be able to meet that goal that we set in the clinic. Um, so I love body composition scales because they give us a broader view. And like when I'm talking to somebody on a follow-up visit and they didn't reach their weight loss goals, like it's a broader view. We got to ask more questions and find out, like, it's not non-compliance, it's increased stress at home, more responsibilities, lack of time, unreasonable goals. You know?
I have so much to say on noncompliance. That was a big, I've talked a lot about the importance of words and language in our counseling. And for me, noncompliance also is one where it gives you the writer of it or the judger of it, this power over where
Right.
it's saying, I told you something to do and you didn't do it.
Mm-hmm.
You're bad. Where do we
Yeah.
go from there?
Right.
There's so many implications of how that both jeopardizes that relationship,
Mm-hmm.
and puts you, I do not ever in my counseling practice, I did not ever want to be the top down,
Or the, yeah.
right? It
Mm-hmm.
wasn't a, I'm here and you're here. It's, I'm here as a guide. I'm here as a facilitator. You're the one who does all the work in between the visits. I'm not even really here to give you advice, because your life,
Gosh, right.
what's going on. I can help you come up with a plan once we've decided on that, but that sort of me judging you as non-compliant really was never helpful.
No.
And I think it's really, it's a tricky thing, right? The
Mm-hmm.
advice giving piece of what we think healthcare is supposed to be about,
Right.
and what it ends up being a lot more in the individual counseling. You're
Mm-hmm.
on a journey, you're making your own path type of thing. So
Yeah.
I love the way you put that too, with saying, I've been non-compliant with everything I've set out to do,
No, for sure.
because it's not all or nothing. So it kind
Yeah.
of gets you in that
Yeah.
focus too. Yeah. Yeah, that's an interesting one. There's a lot of words, adherence even,
Oh, yeah.
kind of, it's putting people in perfectionist thinking, which we know how detrimental that is.
Yeah. And that
And
whole black and white, and I'm wrong, and I'm a failure, and that's not helping anybody
yeah,
reach a goal. Yeah.
yeah. So yeah, I agree with you. I think body comp does help in giving people a few things to look at. In particular, I really like visceral adipose tissue as a measure of sort of, for us taking the waist circumference and putting that into the mix with the
Yeah.
formulas for using raw impedance data, because we can really get to a better sense of where the adipose tissue is and how that impacts their health. But I would
Mhm.
always see folks who maybe had a high weight, maybe had a high body fat percentage, but if they were not carrying the weight around their organs and had a low waist circumference and a low visceral adipose tissue, it was really exciting to show them, hey, your risk of these things
Yeah.
is lower.
Uh-huh. Yeah.
So, and in certain ethnicities, there's different body shapes, there's different ways they carry, adipose tissue, and some who have, higher levels of fat-free mass just genetically. So it's important also to take a look at that when we're looking at, the different distributions of
Mhm.
where and how much adipose tissue somebody has.
Yeah. Agreed. Yeah.
Cool.
I don't know what the right words are, and everyone is as different. I was just talking to a bariatric friend who is struggling with weight regain, and she'd posted something about it, and a surgeon commented like, "Oh, but it's not about the number; it's about how you feel." Which there's truth for sure. It's about how you feel and your health, and not just the three digits. But it struck her a little hard because she was like, but that number affects how I feel, and how I feel matters in my whole health.
Mm.
So it's just another example about how we maybe as healthcare providers can just kind of spout off with some quick responses without thinking about that individual and how they're going to hear it.
You're
Yeah.
right. It's funny. I had a similar conversation with a friend who's had surgery as one of her therapy
Mhm.
options and is now on a medication, and she was talking about weight. number on the scale and how that is not so important anymore. But then she was giving examples of different things at different weights. And so we got into a deeper conversation about how even though she gets that it's not all about weight, our generation, it's really hard to undo that sort of long-term repetitive damage, I would say. And so
Mm-hmm.
we were talking about how with the most recent Lancet report on preclinical and clinical obesity and how looking at excess adiposity just in a different way,
Mm-hmm.
we were talking about that and kind of saying like, how do we do this for the people who have the disease right now and then the future? And I almost wonder if for like your friend and for mine, who we were talking about here, is it too late to repair that relationship, but can we do better with the next generation? That's sort of, it is really hard even for us. We've been in this field for so long.
Yeah.
I know what all the things, right, in the head sense, but
Yeah.
actually doing it and in the actual psychological side of it, it is a totally different story.
Mm-hmm. For
So
sure.
I do hope that we can, that all those phrases, that it's not just about weight, it's not, we can say those things. We have to understand that there is a really complex and strange relationship that differs for everybody, and
Mm-hmm.
that completely minimizing it doesn't help that person deal with it either.
Yeah.
So, yeah, you might say you're not focused on that, but you do need to kind of unpack what that
Right.
is.
Right. Yeah.
Well, I'm glad that they have you to do that with, because I know, you're definitely, you found a gem there, but they found a gem with you because I don't think every dietitian has such, breadth of experience,
Mm.
especially with the sensitive and important nature of talking about, severe obesity.
Yeah. Yeah.
All right. Well, I'm gonna have to come visit you up at this new
Yeah.
spot for
Come on.
sure. Maybe a month.
Yeah. Come on. Yeah.
And hopefully we get to stay connected with some of the conferences and everything that you still go to.
Yeah. That would be great.
Cool. Well, thanks, Jeannie. This was a really fun conversation. I feel like we could go off and talk about any one of these topics for another hour or two. So I
For
appreciate
sure.
you.
Yeah. Thanks
All
so much.
right. Oh, hey, how do we stay connected with you? What are your
Sure.
best
Um,
socials these days?
so social Instagram is Jeannie Boyer RD.
Okay.
Facebook's Jeannie Reed Boyer. And you can email me at jeannie@jeannieboyer.com.
Okay, awesome. Well, I'll put that in our notes. And thanks again for your time today.
Yeah, of course.
Bye.